In 2018, it's absolutely necessary that every patient with advanced non-squamous non-small cell lung cancer have testing for, at a minimum, 4 molecular targets that have FDA-approved therapies associated with them. That's EGFR mutations, ALK and ROS1 gene fusions, and BRAF V600E mutations. And the traditional way to test for these has been to do single gene tests, where you test for each of them and then you bill your insurance for each of these individual tests. Alternatively, you could do a single broader test using something called next-gen sequencing, or NGS, which can look for a virtually unlimited number of gene targets. So as this expands and things become even broader, this test can expand easily without any additional cost to look for all of these. So what my colleagues and I did was we created an economic model of a hypothetical cohort of 1 million patients in the United States. We calculated how many of them were likely to get lung cancer to be covered by Medicare or private insurance. And then we tested 4 different ways of testing them. One was upfront NGS for all of the approved therapies as well as some up-and-coming markers. One was sequential single gene testing, where they test for EGFR, ALK, ROS1, and BRAF in sequence one at a time. One was called exclusionary testing, where we tested for KRAS mutations, which is the most common mutation. And if they were positive, then of course they didn't need any further testing. And then the final one was to do all the single gene tests at once. And that was what we called a hotspot panel, and it's very commonly done. And what we were able to show was that there was significantly lower costs to payers to pay for everyone to have upfront NGS testing versus paying for any of these other strategies using single gene tests. In addition, we got them done faster, with on average about 2 weeks, and we missed fewer patients who would fail tests and have to have repeat biopsy. So it was both the best strategy for clinical care, but ultimately from a payer perspective it makes economic sense as well.